All right, if everybody is ready, we'll get started. So good afternoon, everyone. My name is Kathy Lee, and I'm a current student at New York University, and I'm studying politics, and I'm also a summer intern with the John Bradman Center at NYU this summer. So thank you all again for joining this afternoon's webinar, Collaboration in Crisis, the U.S. Without the World Health Organization. Today's webinar is made possible by NYU DC Dialogues, the John Bradman Center of New York University, NYU School of Global Public Health, and NYU's Rory Meyers College of Nursing. Today's discussion will delve further into the consequences of President Trump's decision to formally withdraw the United States from the World Health Organization and how this decision will impact the current global fight against the coronavirus pandemic. Today's expert panelists will include Dr. Georges Benjamin, the Executive Director at the American Public Health Association.
Hi, glad to be here.
Great. And we also have Dr. Chris Beyrer, the Desmond M. Tutu Professor of Public Health and Human Rights at Johns Hopkins University.
Good afternoon, Kathy, and welcome everybody.
We are also joined by Dr. Chris Dickey, Director of Global and Environmental Public Health at NYU School of Global Public Health.
Hi, everybody. Nice to be here.
And also Dean Eileen Sullivan-Marx of New York University's Rory Meyers College of Nursing, and also the president of the American Academy of Nursing.
Hello, everyone. Thank you, Kathy. Good to see everyone.
And moderating our conversation today is NPR's Global Health and Development reporter on the Science Desk for National Public Radio, Pien Huang.
Hi, thanks for having me.
So to our attendees, please be sure to enter any questions you may have into the Q&A box at the bottom of your screen, which Pien will turn toward to the end of the webinar. And with that, Pien, thank you so much, and I'll hand it over to you.
Thanks for that intro, Kathy. So thanks everyone for joining us. We're going to be talking about a very important topic today. We are currently in the middle of a pandemic, and President Trump has decided to withdraw the United States from the World Health Organization, which is the agency tasked with coordinating a global response to the pandemic. So we're going to be talking about what's happening and what it means for the WHO and for the US today. So my first question goes to Dr. Chris Dickey. So earlier this month, the Trump administration gave notice to the United Nations, which is the parent agency of WHO, telling them that the US is officially withdrawing from the organization. Dr. Dickey, can you help us understand why the administration has decided to withdraw from WHO right now?
Well, their official word was that they decided to withdraw because of unresolved structural issues and because of some failures during crises. That was the word from the administration. But it did seem to catch a lot of people within the administration at the very senior level off guard, which leads many of us in public health to assume, and I think correctly, that it wasn't really well thought out. It wasn't part of any kind of a coordinated strategy. It wasn't any kind of a plan. It was done really probably for reasons other than the stated ones. And if you look at it carefully, given the administration's position on blame shifting and credibility during this crisis, it does look an awful lot like an attempt to shift the blame, possibly not just to WHO, but to the government of China, and WHO being, in a way, kind of a casualty of that attempt to shift blame, so that maybe the administration's own failures, which are many, are not quite as carefully scrutinized.
Sure, and you know, the president has said that the WHO is too China-centric. He's been complaining about how much money the US pays the organization compared to other countries. Dr. Georges Benjamin, you co-authored a commentary in The Lancet that says that it's actually unlawful for the president to withdraw from the WHO. So is the withdrawal really happening, and where are we now with that process?
Well, the withdrawal is happening, and it's going through a process. So this is, we participate in this organization by treaty, and it turns out that what the administration has to do is give notice, and it takes about a year for that to happen. Theoretically, we're supposed to pay our dues to the organization in the interim as part of that process. And, you know, the United States has never really been very good at paying our dues anyway. So Congress could probably pass a law to stop this from happening, but of course it would have to be signed by the president. And so they would have to be able to, override his veto, which means that, at least from process perspective, they can probably get away with it. Again, I think the good news is that they can't do this till next year. So any new administration would be able to stop this, or if one could convince this administration not to go down this foolish path.
Yeah, absolutely. And as you mentioned, we do owe quite a lot of money in back dues, about $200 million to the World Health Organization right now. And there actually was a bill introduced last week by 2 US senators to try to stop this withdrawal from happening. But as you mentioned, there also is an end date, a year from when that was submitted, July 6, 2021. So there is an official end date for the US participation in WHO at this point. So I wanted to turn to what this means for WHO and for the US. I mean, the US has been WHO's largest funder, usually in the last couple of years, accounting for about 15 to 20% of their budget. So I wanted to ask Dr. Chris Beyrer, what does this mean for WHO's ability to continue to function?
Well, of course, the money matters and the resources really matter. I think that's not all that matters. What also really matters is, of course, that the US has extraordinary scientific public health leadership, that separating ourselves, pulling out of that relationship really is harmful on many levels. Just one example is that it's a WHO convening power that typically makes the decisions about what antigens are going to go into influenza vaccines every year for global use. And the US, sits on that body. So that those kinds of things then come into question. And also, of course, when we have a pandemic situation like the one that we're in now, it's arguably the time for global solidarity and for US engagement and leadership with WHO and with all the other member states. And so, again, to pull out in the middle of a pandemic is also has political consequences, important political consequences. And I'll just give you one example of that, is that WHO now is embarked on a major effort around ensuring vaccine access to COVID vaccines, should one be developed and be available. That is very important. I mean, if COVID has taught us anything, it's that pandemics respect no borders. Every country is affected. We're all in this together as a human species, as one human family, if you want to be sort of big picture about it. And for the US not to participate in that global vaccine exercise is, of course, a concern for everybody else. It's an abrogation, if you will, of our leadership in science. But it also potentially could be a real problem for the US, because we may be the country through Operation Warp Speed that develops a successful vaccine. We may not be. It may be that you can't know until you do the research, that it may be that another country, including China, which is already doing a phase 3 trial, or the European consortium, comes up with a vaccine. And if we're not part of the global access discussion brokered by WHO, we could end up in a real situation of instead of coming together as a world to ensure vaccine access, getting into a really challenging dynamic of wealthier countries competing with each other and not getting to protection of the human species. So I think the money matters, but there are many other aspects that matter as well.
Absolutely, thanks. And Dean Eileen Sullivan-Marx, I wanted to turn to you as well on that same question. I mean, what does this mean for WHO and for the US in terms of our ability to respond to the pandemic, that the US is, withdrawing funding and withdrawing participation in WHO?
Sure, thanks for that question, Pien. And to pick up from what Dr. Beyrer was saying, there's many other aspects of how WHO works together with universities, scientific community, professional community. A response to either preventing a problem or responding to a problem requires huge team effort. Nothing's ever perfect. I mean, trying to do things across county borders, state borders, country borders is not without problems. But WHO for 75 years has been the place where we come together with all of our warts and all, to work together. And it's the science and the professional teams that make things happen. And you know, the current virus that we're dealing with is very problematic because more than other viruses like SARS, it has this invisible contagion time period. And that's what makes it so very different. It may not be as visibly lethal as Ebola, but it is nonetheless a real assault on our way of life and how we live together as a human family. So without this coming together of teams of professionals and scientists, things will start to fray and not work well together. And not only will things be prolonged with coronavirus, but the next outbreak and the next and the next will start to happen. For example, in nursing. So with the WHO, nursing schools have collaborative centers for nursing and midwifery. There's 40 some of these collaborative centers just for nursing and midwifery, and other collaborating centers come together around other issues and other professional groups. But my experience, for the most part, has been in that area. And one of the things that we work on with nursing and midwifery is maternal health around the world and reducing morbidity and mortality around the world. And it's setting the standards of not only the workforce with WHO, but the standards of who is prepared to do what with education. And if the United States has often, with other developing countries, been leaders in education, but it's the underdeveloped countries that have been the innovators. And by working together with countries such as sub-Saharan Africa or the Congo area of Africa, where nurses are the main providers of all care in villages, that nurses in the United States work together to learn how they do things, and in turn, we share with them best practices in education. And now, through the internet, that has really blossomed to a worldwide scientific and practice learning community that will now start to unravel, because there are 20 million nurses in the world. 4 million are in the United States. So that's, you know, nearly 20% of all of us who are now going to have our hands tied by not being part of WHO. And that's true for public health workers, that's true for dentists, that's true for physicians, respiratory therapists, you name it. We all have this wonderful collaborative exercise going on. And by taking our ball and being mad and going home, it's just an immature way to behave.
Dean, Eileen, I wanted to follow up on that. I mean, are there, you know, since this announcement has been made, have you seen a particular freeze on the collaborations that you currently have through the WHO Collaborating Center? Is there a difference in the way that you interact in doing this kind of work?
I have not seen that yet. I think that people are disturbed and worried, but we stay engaged with one another to reassure that we're all doing what we can. So in the United States, the professional organizations like Dr. Benjamin's organization, APHA, the American Academy of Nursing, American Nurses, other AMA, you know, are all speaking out to say this is inappropriate. We need to stay within WHO. So that gives our peers around the world some hope, but at the same time, by the president WHO, it raises the level of politics and conversation so that the trust starts to shave away a little bit. But at the same time, I haven't seen a change yet because we're holding together so far.
And Dr. Georges Benjamin, I wanted to turn to you as well. So what kind of impacts are you seeing in terms of this decision and the US's ability to respond to the pandemic?
Well, you know, Not a lot, because the good news is that there's a lot of interpersonal relationships here. Most of the folks in global public health have their colleagues, cell phone numbers on auto dial. They were talking with each other as this outbreak developed. They have been talking to each other during this this outbreak, and I believe they will continue to do so. Now, the problem, of course, is that this is an intergovernmental organization. So the decisions are made between governments. And even if we participate as practitioners talking to one another, and even if our intergovernmental colleagues talk to one another, it's very difficult for anything to actually happen if their bosses say it cannot happen. So this is something that has to be stopped, because we're in a globalized world, and global cooperation is essential. And I remind people, while we have political borders, the virus has no political borders. Neither do many of the other diseases and health problems that the World Health Organization, with our help, needs to work on. So we have to have this organization, or one like it, if we're going to be successful on this planet.
Dr. Beyrer, you've worked in the HIV field for a long time, and the Trump administration says we're not funding global health work. We're just going to take the money that we would have given to WHO and direct it towards other ways that we can accomplish our global health security agenda. So what does that seem to be effective and happening, or what kind of what do you see in that line of argument?
So, in the HIV space, and it's not just HIV, because of course the biggest multilateral entity is the Global Fund, the UN's Global Fund to fight AIDS, TB, and malaria. So it's HIV, TB, and malaria. And we have, by statute, been the biggest donor to that entity. We give 33% of the money every year, and then the other donors match it. And that was created when Kofi Annan was the UN Secretary General, and when George Bush was president, George W. Bush, which is rather remarkable that a Republican administration would commit to a multilateral donor organization of the UN. Many in the Republican Party have been opposed to UN funding for a long time. So George Bush really did something quite extraordinary there. Barack Obama continued that funding. And the Trump administration has tried to cut it, but has been rebuffed by the Congress. So Congress has maintained that support, and it's currently well over $3 billion a year. Now, in addition to that, there is the U.S. bilateral program. That's the President's Emergency Plan for AIDS Relief, or PEPFAR, which was initially, again, created by George Bush with $15 billion over 5 years, again, expanded under President Obama, and has continued under the current administration, again, because of the Congress. And that's the largest commitment of funding to a single disease in history by any government. So it's important to remember that the American people have been remarkably generous here, and the Congress has been remarkably generous. But the issue with HIV, of course, is that we have gotten now more than 2/3 of the people living with this virus worldwide on therapy. That's more than 24 million people. But those people need to stay on treatment every day for the rest of their lives. And so there's no backing out of our global commitments to HIV without enormous consequences. And of course, one of the things we're very worried about with COVID is the impact that it appears quickly to have had on a number of global health parameters, but including on HIV, on TB. The UN put out a report just a couple of weeks ago about the likelihood of 500,000 additional deaths to HIV and TB because of the impact of COVID on those programs. But also this is affecting childhood immunization, where the UN has a very important role to play, as does WHO, and maternal child health and contraception, family planning. So all of these are domains in which it's so important to stay in the multilateral space, to continue engagement with WHO and the other UN agencies. And so the argument that we could pull out of WHO and maintain our bilateral funding has some merit, there's no question about that. But on the other hand, it's also the case that if we withdraw from the multilaterals, it would have enormous impacts because we are the biggest donor. We continue to be the biggest donor through the Global Fund and PEPFAR.
Absolutely, thanks for that. And Dr. Chris Dickey, I wanted to get you to weigh in here as well. I know that you've done a fair amount of work with the UN, and what do you think about the ability of the US to continue making progress on our global agenda without participating in WHO?
Well, I really want to thank my colleagues for such excellent comments on this, because I think they're exactly right about the implications for the US and for global health about this decision, which could end up being one of the more disastrous decisions that our administration has made, and they've made plenty. But I wanted to add a little bit, one of the great things about the WHO as a convening body, as Dean Eileen was referring to, is that it brings people together for formal meetings, of course, and that probably could be replicated, I suppose, even in a Zoom or something. But the value for many of us is the informal meetings, the serendipitous meetings. The fact that WHO in many ways acted a little bit like a water cooler. I don't want to trivialize it because it's much more than that, but it brought people together and gave them the opportunity to meet and to discuss ideas in a way that is not possible if we structure it very formally, or even if we engage in bilateral agreements, as Chris so accurately said. So we lose that. You lose that. We're losing it in classrooms when we're trying to teach. We lose the ability to have these serendipitous meetings where all of a sudden you're standing next to somebody and you realize that you've got common interests and common strategies, and next thing you know, you're collaborating. The next thing you know, you're creating an innovation that would not have been possible without a meeting like that. And if we lose that, we really lose the sense of the ability to innovate, the ability to collaborate, the ability to grow the pie of global health. It's just very, very challenging without having this relationship.
Yeah, absolutely. Thanks for that. And I mean, even though we're all talking about how the WHO plays a really important role, we also acknowledge that it's not a perfect organization, that there are, issues with the way that it's run. And I wanted to sort of ask you all about what types of issues you see in the way that it's structured. Why is it constantly being criticized for not playing the role that people want it to play? Maybe Eileen, Sullivan-Marx, I could start with you. Dean Eileen?
Thank you. There's no, as you say, there's nothing perfect about these organizations. When you come together, and I see someone in the chat is saying, why should we put the money into this? Well, if we just decided everything on money and what's fair for one organization or another organization, we would never be sitting down and figuring out how to work together. And the issue that happens when we politicize, as Dr. Benjamin said, it's a government relationship. You aren't getting into politics, and politics is about shifting of power. But with this action, we've removed ourselves and left a power vacuum, and that's never a good situation to be in. You can negotiate around how much funds this one should spend or that one should spend, or how it's being spent, and say that I think we should renegotiate that, as opposed to saying we're out of this and we're no longer a part of it, because then someone else will pick up on the power of how the dollars get spent and who's the convener and who's inviting people to be in the room. And that is the piece that's going to be missing if we're not there, because it'll go on without us and we won't be able to put it together.
Dr. Benjamin, go ahead.
Yeah, public health is a collaborative sport. We improve the health because we work and play well together with others. And just because we don't like the way the game is going on, we take our basketball and we go home, metaphorical explanation in the US, the game's still gonna go on. You know, the fact that we decide, oh no, we don't wanna put any money in this and we're gonna go away. So who do we think's gonna put money on the table? You complain that the Chinese have more influence. Well, that's because we walked away. We're not playing, we're not participating. We've not been an active, engaged partner. And what's gonna happen? They'll have more influence. The Russians will have more influence. Some other nations will have more influence, and maybe that's good for some parts of the world that they have more influence. But, you know, we've always kind of been a silent partner there. We've always, exerted enormous influence behind the scenes. And, you know, we helped found the World Health Organization. I can tell you, by the way, the American Public Health Association was a strong proponent of W.H.O. being founded because we understood that if we're going to live on this planet together, we had to work and play well together. And if we walk away from the World Health Organizations, others will do it, and we won't be part of that. We will not be part of that solution. So this has to be reversed. It's just not an option for us not to be at the table here.
Could I add to that, if I might, Dr. Benjamin? I couldn't agree with you more, absolutely. And I think there's another aspect of this that we should be mindful of, which is that the rest of the world has looked to the US because of the strength and quality of our regulatory aspects and structures, like the FDA. The fact that our system of science, our NIH system, is based on randomized controlled trials, that we have this extraordinary system of checks and balances really within science. And there is a lot of concern with a number of these other important players and donors whose systems are much more subject to political manipulation, or have been in the past. That has been a concern with China. That is a concern with Russia. You know, the Chinese SDA has gotten into trouble with making things like infant formula and pet food that turned out to be not safe, right, with additives. The systems are not as transparent. Of course, they're not democratic. And so we have played a very important role. Companies that have developed products all over the world want to go through US regulatory approval because it is really a gold standard. The Indian generic manufacturers who make so many of the antiviral drugs that we use all over the world have gone through the FDA process so they can sell their drugs to PEPFAR and to the Global Fund and distribute them in low-income countries. So that's a critical scientific leadership role that we have played. Any suggestion that the US is backing away from that, and that, for example, the FDA is being pressured by an administration into politicizing scientific decision-making, is catastrophic for us. That happened with the hydroxychloroquine mess. Where the administration touted an unproven remedy before it had gone through clinical trials, and then subsequent research really started to show that, in fact, there were significant side effects and health concerns, mostly cardiac complications, that really made this a challenge. So that's extremely important too. And this idea of go-it-alone isolation has never been the way that we've made global health advances. And so it's part of a very worrisome trend of the potential politicization of our science and our public health. And that has been absolutely one of the domains in which the United States has played such a critical leadership role in world health. We lose that at our peril.
Thanks for that, Chris. And Chris Dickey, I want to turn to you because, on this point about credibility and the undermining of the, credibility of our science institutions, what do we think that the WHO currently stands for right now in the middle of this pandemic? Do we feel like it is also a very politicized institution at this point? Do we feel like it stands for scientific credibility? Like, what is the what is the thing that WHO stands for right now?
Well, I think before I directly answer that, I would say that the WHO, as has been said several times, has significant challenges that it needs to overcome. It's not a perfect organization by any means. And I think that the pandemic has shown quite a lot of the structural weaknesses in the way that WHO makes decisions, the way it allocates resources, the way it prioritizes health decisions. And I think that it's probably very clear to people within the organization that it's not any news from us to tell them that there's some really significant structural changes that have to happen. And I think that to the point that my colleagues have made is that we really need a seat at the table in making those structural changes. And then remember that the organization is operating on a tiny budget, really. It's really, for the budget that they're allocating, it just, when you think about the responsibilities and the accountability that it has, it's really amazing to try to set that level of expectation. And so I do think that credibility is a major, it's a major factor for WHO. It's something that the world counts on. In fact, the world was looking to WHO for global leadership and a global strategy. And many of us were disappointed in global health that we did not see a convening of a global strategy to deal with this epidemic, to deal with the pandemic. But I do think that in the absence of other organizations, the WHO's credibility is what we have to rely on. And actually, I feel pretty confident that the decisions that it makes and the science that it uses to make those decisions is quite credible. It's very, very credible. The people that work there are professionals and they know what they're doing, and they're as talented as any professionals that any of us have worked with. So I think that this charge of a lack of credibility is not founded in anything that somebody could really prove with documentation. It's just not there.
Dr. Benjamin, it looks like you're wanting to jump in.
No, I'm just pointing out that reminding everyone that this was an intergovernmental organization, and so it addresses the consensus in general of the various nations that are its nation members, and so it's not like this is an organization off on its own. Tedros, who by the way has been a very good WHO director, has to walk a very fine line between governments. And yes, he has to do good science and provide good health care in general and good public health broadly. But he does have to walk a fine line when he's speaking, because he's actually speaking within the language of diplomacy. And so he does have to say things that we in the healthcare community would not normally say, or the way we would say it, because we're not in the diplomatic space. We're not speaking for nations. And he has to speak for nations. So you have to listen very carefully to the words that he uses and how he says it. And yes, sometimes he has to praise people who get on his last nerve. But he has to do that in order to address the broader issue. I know this guy. I've known him for a while, and it turns out he's pretty good at what he does in terms of working with other leaders. But that is just the point. He does have to work through governments because he's not an entity unto itself.
Dr. Beyrer, do you agree with that? Do you think that the way that the head of the World Health Organization speaks is appropriate for his role, given that he is out there praising China and, talking about what great work everyone is doing on this pandemic?
Well, as Dr. Benjamin pointed out, and it's absolutely right, this is a UN member state organization, and his constituency is every member of the UN family, which is just about every country out there. So that, I think, is a challenge always. And it's one of the reasons why we sort of love the UN family, because it represents all the countries in the world, and why everybody is always upset with it, because it's a very diverse, cacophonous world. I think, a significant challenge, of course, for WHO is also that they have other donors. I'll just give you an example that I'm on the WHO Scientific and Technical Advisory Committee on HIV and viral hepatitis. And by the way, that program, the HIV and viral hepatitis program, is now headed up by an American woman who's a colleague of mine from Johns Hopkins, Dr. Meg Doherty. So this is also going to be a question of what happens to the American leadership within WHO if we actually withdraw. But that Scientific, Technical, and Advisory Committee also has oversight of the budget. So it turns out that the last time that we convened, the budget was around $45 million. It's a very small program. Its principal role is regulatory, providing guidance, regulatory guidance for countries. And in most parts of the world, the WHO guidelines and recommendations and approvals for drugs have enormous weight because that is the global body. It's never been the same true in the United States. But just to say, of that $45 million budget or so, 40 million is from the Bill and Melinda Gates Foundation. So the Gates Foundation has a large voice in the decision-making with HIV programming, and of course has supported the regulatory affair component in a major way, which has been a great thing. But we have to remember that they are also beholden as an organization that is always strapped for cash for other donors, including some of the big foundations like Bill and Melinda Gates Foundation, which of course is happily very engaged in the global health space, but also has its own agenda. And that agenda is not always the same as the member states. I think when you look, for example, at the early period where there was pressure and there were many voices in public health saying WHO should declare a public health emergency of global scale, and WHO was taking a position that the virus really hadn't spread to enough countries and it hadn't left China yet, and it was mostly looking like it was going to be contained. That probably was not a good decision, right? In retrospect, with 2020 hindsight, we should have said, whoa, this is an extremely infectious virus. As Dean Eileen noted, it has this ability to spread asymptomatically and very fast. And it's always easy to look back and say we should have done that right. On the other hand, they did support China in putting the genetic sequence of this virus online within a matter of a few weeks of the uncovering of I think it was January 6th that the genome was put online. And that has allowed for all these companies, including the ones the US is supporting, to make vaccines. And that's why we're able now, we just started Monday, the first efficacy trial of a candidate vaccine in the US. That company, Moderna, based their vaccine on the genetic sequence that was made available to everyone in the scientific community globally. That's international collaboration and solidarity. And if it leads to a vaccine, we'll all be profoundly grateful.
Dean Eileen, I see you nodding in assent. Would you like to jump in?
Yes, absolutely. I think we brought together a number of points of why you always work together and work out the differences within the UN and within the body. The thing that worries me and why our Academy of Nursing took a very clear stand early when we heard of the threats that this might happen was because if this starts to happen, then what's next in the public health world and the UN, and what's next and what's next? So we as organizations have to be able, and as leaders in public health, speak truth to power because our colleagues within FDA, within the US Public Health Service need our support to say the things that they are saying quietly, or that they know they're making points as to why this should not happen. And the United States Public Health Service used to be much larger decades ago when I first was in college, and it's a much bigger organization where there within the United States, you had public health service hospitals and clinics in every county and every city, and there were professionals hired. And then that slowly, went away over decades of different funding support for then other not-for-profit and private sectors to take over, which, long story short, means that within the United States, we don't have as a robust governmental public health service system to respond in the way we think we should be responding to this particular virus. And that means that then within our government, there needs to be stronger citizen and professional voices to speak to our statements of why webinars such as this are reaching out and why we need to be very clear that this is a very wrong move for the health of the United States, for the health of the world. And we need to be clear about that. This isn't a political statement that we're making a health statement. And we are the ones that need to be making it right now and holding the line.
Absolutely, thanks for that. I wanted to get in one more quick question before we turn into our listener questions, but maybe I'll start with you, Dr. Dickey. As Dr. Benjamin mentioned, there are many people in the global health world who are looking to November's elections and saying if there is a different leader in place, this decision will be reversed. But I do want to hear from you about, what happens if this break between the US and WHO actually becomes permanent? How does it reshape what global health looks like if this is something that lasts for many years? Dr. Dickey?
Yeah, I mean, I agree with Dr. Benjamin that some other country or some other large donor is going to step in to fill the void, because the WHO will continue. It's not going to go away. It's going to continue to monitor health challenges around the world and the most vulnerable populations. It's going to continue to work with governments to make sure that health systems are as strong as they can be. It's going to continue to provide vaccination programs. And if the US is not there, then another donor, another country's priorities would likely be featured a bit more prominently. I mean, it's a big danger. The other thing is, I think, just to add to Dean Eileen's remarks, is that it's a general loss of collaboration, not just with WHO, but with all of the global organizations, with all of the UN organizations. And I think that if US citizens get into this mindset that it's not a global community in global health, it really is at our great peril here. And I think that we need to very quickly, one way or the other, work to disavow American citizens of this idea that the money that is being spent on tax dollars is going to benefit somebody else, and tax dollars is going to benefit another citizen in another country. We get direct benefits, absolute direct benefits, and way more than we put in by being a part of this organization and other UN organizations. The return on investment for the US is way higher than if we were to try to do this on our own. So I think that that's something that the American public needs to understand. It's something we spend a lot of our time in global health, making sure that our students understand. But as an investment case, the WHO is a pretty safe one.
Dr. Beyrer, do you want to jump in?
Yeah, I think that's absolutely right, and it's certainly, if you ever wanted evidence that a pandemic threat could, emerge from somewhere very far from the United States and cause us all of the suffering, the economic suffering, the loss of life that this virus has caused the American people. This is the teaching moment, right? And it is, I think, an extraordinary, painful lesson in both the global nature of these kinds of threats, the likelihood of additional pandemics. People often say, who would have predicted this? Oh, everybody in global health. That's who. Tony Fauci is on record. In fact, after the very severe West African Ebola epidemic, which occurred during the Obama presidency and the very large US investment with WHO in responding to that, the White House stood up an Office of Pandemic Preparedness, precisely because of the likelihood of this kind of a problem happening. And of course, that office was shut down by this current administration. A decision that you would, to quote my grandmother, was penny wise and pound foolish, as we have learned. And the same, of course, was true for the Office of National AIDS Policy in the White House that was first stood up in the Clinton administration. It was maintained through Bush, through Obama. It played a very important role in developing our national AIDS policy, a national AIDS strategy, and it was gone within weeks of the inauguration.
Could I add one more thing? Let's focus on COVID. Right now, we have an agreement with all the nations in the world that we will share genetic material and information. For this particular outbreak, had we not had that agreement, we would not have had the material to create the test at all. We finally got it right. We would not have had access to the material. We would not have had access to that information. So if people want to know what have you done for me lately, they gave us the information we needed, even though we botched it early on. They gave us the information that we needed to begin to address this outbreak. We just didn't handle it well.
Mm-hmm.
And we should not be relying on anybody else's information, communications about whether it's a pandemic or any of that kind of stuff. We're perfectly capable as a nation of doing that stuff ourselves. And quite frequently, the United States is very quick to say we don't follow anybody else's advice or anybody else's recommendations. So for all those people out there complaining that the World Health Organization did not call it a pandemic as quickly as we thought we ought to call it as a pandemic, we were still debating that ourselves in the United States. So they did a lot for us early on to help us. And we ought to be real clear about that investment that we made.
Thank you. I'm going to turn now to some questions that we're getting from listeners. One is from Sabrina Wu, who asks, and I think I'm going to turn to you on this, Eileen, does the US currently partner with countries such as Canada or EU in solving public health issues? I think it's a question about whether we have relationships with countries independent of our participation in WHO.
We have relationships among health professional organizations. I'm sure the American Public Health Association has relationships with other, Canadian Public Health Association, et cetera. Nursing does with Royal College of Nursing, the Canadian Nursing Association. We do that. The way we do it globally is through our International Council of Nurses, who has a relationship with W.H.O. And it's that collaboration that brings everyone together. And I think that, for example, that the collaborating centers that we have in nursing through WHO are by region and region of the world. And so we collaborate in North America and with Caribbean area for aging projects and improving knowledge that we have on health education, education of nurses related to caring for older adults, which is a major world problem, world challenge. And so I think that you can't say, oh, well, North America is just going to talk to North America, if that's what the questioner is thinking about. You have to be talking with everyone. I mean, the sunsets in the Northeast right now are gorgeous because of the Sahara Desert sand that is in the air. And because sand doesn't pay attention to borders, nor does viruses. We cannot say that these artificial borders that we've created politically can give us the same thing that we might need. It just doesn't work that way. We're on a planet.
Yeah.
Let me add that regionally,
Oh, please do.
the Pan-American Health Organization, of course, is the way the nations collaborate within our region. The dean is right. We do organization, Canadian Public Health Association, the Mexican Public Health Association. We even have an association of alliances of all the public health groups in our region that works together. But from a nation-to-nation perspective, it's through PAHO, which of course is the regional office for the World Health Organization. And I just remind people, PAHO was formed before we had WHO. So WHO was formed based on the fact that we saw PAHO work so well in our region.
Dr. Beyrer, do you want to jump in?
Yeah, just to say there are other important multilateral relationships, and one of them is through the national academies. So we have in the US, the National Academies of Science, Engineering, and Medicine. And we collaborate with national academies in many other countries. And those are, I think, really important bodies. I'm on the National Academy of Medicine, and we have a human rights program that collaborates in multiple countries on health and human rights issues, and I think plays some very important kind of behind the scenes roles. So collaboration is in the DNA of public health. It's really what we all do.
Thank you. Our next question comes from Michael Sanchez, and Dr. Dickey, I think I'm going to come to you on this one. The question is, to what extent can cities in the US participate with the WHO, akin to when many decided to uphold Paris Climate Agreement standards and communication? How far can that get us, and what are the limits of the effectiveness of cities participating in WHO when the US federal government does not?
Yeah, I think it's a really interesting question, because in many ways, cities have taken the lead in the US on the SDG initiative. Where the United States government has been 3 or 4 steps behind on the Sustainable Development Goals. And as you know, these are the 17 large, very ambitious goals that have been set out and agreed to by 195 countries. The US has been slow. We've really not been a great partner, but if you look at the response by cities like New York City and other major American cities, that response has been quite dramatic and substantial. And in fact, it may be that we will find our greatest allies in the global health community with Meyers, rather than with the federal government in many cases. And I don't rule out the possibility that WHO would also find many of its greatest allies among some of our more influential mayors in this country, and that's fine. And I think that's just totally fine. I would also say that I wouldn't rule out the collaborations with universities. WHO has been a really terrific collaborating partner and an effective glue that brings together universities from our region, so the universities that we all represent on this panel, and universities in the global south, like in East Africa or in the Middle East and North Africa. And WHO has been instrumental at bringing together these types of collaborations so that we could build capacity, that we could engage in research projects. And so I think that mayors, I think universities, I think there are a lot of other organizations that will fill in the gap, and have already started to do that anyway.
Yeah, Dr. Benjamin, I'm curious about what you think of that as the head of the the APHA.
I'm not sure I got the question.
Sure. The question was, whether cities can participate directly in WHO and continue these activities, regardless of whether the federal government participates in WHO.
They can, so for sure. Now, there are issues around treaties and how they engage, but a lot of these cities come to the World Health Assembly every year and kind of hang around the halls and lobby and talk with people. So I think that many of the relationships through cities will be helpful. But like the WHO withdrawal, we're hoping that the leaving the Paris Climate Accord will also be reversed with any future administration.
Absolutely, thanks. Another question comes from Carly Malberg, and Carly asks, say this administration continues for another 4 years and we do completely withdraw from WHO, what is the likelihood of the US withdrawing from other organizations under the UN and these bilateral programs? And more importantly, what would that mean for the US and our role in public health and being a global partner? I'm going to turn to Eileen Sullivan-Marx on that, Dean Eileen, because you had mentioned that that is a concern about, you know, what happens, is there a ripple effect that goes beyond the WHO?
Yes, thank you. That's what I had seen that question in the Q&A, and the issue is exactly what is, you know, the ripple effect. And, you know, from a practical point of view, what is the ripple effect if now that trust is lost, now that we, you know, well, you know, how can I collaborate with you on this project if your government isn't going to back us up on something, as I said, related to aging or children's health or maternal health, and it to put us on our back heels as a nation. And representing, you know, American nurses, it puts me in a very difficult position if my government is saying to me, we're not playing with them. And I'm representing a group of American nurse scientists. It's problematic. And then from the practical point of view, yeah, we can do runarounds, and I would consider, you know, Meyers setting up separate relationships and universities setting relationships and universities getting together. New York University is a global network university, so we have relationships around the world, and I can get things to work. However, it just takes a lot of the air out of the balloon, and it decreases that kind of trust. So if we are 4 years out again, it'll be that many more years plus to regain the influence that we have. And meanwhile, our scientists are still working, hopefully, and we still are having, we still have students. We have another generation. We know that the generation that we're teaching right now is very hopeful for the future, and they are interested in public health. Our public health schools and in the health professions, the interest in public health as another minor or a dual degree to put together is very strong. And even from economic perspective, understanding public health is a very important area. So I digress a little bit from the question, but it does get me going down the ripple effects of when our universities are undermined by government positions like this.
We've got about a minute left, but it looked like Dr. Beyrer, you were about to jump in as well. Do you want to put in any last remarks?
Well, I will just say that you know, the ongoing effects of this overall isolationist U.S. first policy, if it were to continue, would, I think, have the negative consequences you've heard from all of my colleagues here, but also I think many others. It is a globalized world. It is a world where we have to address global threats like climate change together. And there is no going it alone as a success strategy. That is a strategy for actually going backwards on so many of the gains we need to make. And I think one other thing we've seen from COVID, this global economic slowdown has also led to what climate scientists are calling radical decarbonization, and a view of what a different economy might look like as we come back from this pandemic. We need to be a part of that. We need to be a part of that solution and a part of that engagement.
Great, well, thank you so much. That's all the time we have, so we're gonna leave it there. This is obviously a topic that will be continued as we go on, so I wanted to thank each and every one of our panelists today for their really thoughtful remarks. I also wanted to thank NYU DC Dialogues and NYU School of Public Health for convening this panel, and I also wanted to thank everyone who's tuned in today. Thanks for spending some time learning about this important topic with us, and have a good rest of your day.